Hello, my name is Cynthia Burghard. I'm the Research Director at IDC Health Insights, and my area of practice is around accountable care. I've just gotten off the stage from the IT Summit, where I was talking about the importance of population health management in achieving accountable care results. A year ago, we didn't really have a roadmap of how to get there. That roadmap we've developed as part of a maturity model. We've identified areas that will affect sustainability, and we've done extensive research on the population health management market, where there really is a tremendous range of capabilities. Some very exciting, some need to move a bit further. And finally, I closed by talking about the idea of community health, and that health is driven far and exceedingly greater by non-clinical issues. I think we're going to continue to see maturity. We've seen already from the Pioneer program that there were 9 organizations that had to drop out because they weren't successful. So we'll continue to see some level of failure. But I also think we're going to begin to see some successes. There'll probably be some of this low-hanging fruit, but we are, for instance, at Blue Cross of Massachusetts, really seeing outcomes, clinical outcomes, improve dramatically. So I think we're going to continue to grow despite efforts to unravel the federal program. Well, in the maturity model, I have about 10% of organizations at the ad hoc stage, which is the very beginning sort of proof of concept. Let's dip our toes in that. And then another 50% in the second stage, which is the stage around taking a look at the opportunity, being opportunistic. As risk contracts are offered to me, I'm beginning to accept some of them, mostly just upside risk. And then the last 40% are really sprinkled across the stage for repeatability, for management, and ultimately optimization. And I think in 5 years, that's going to switch, and we'll see more organizations at the top of the maturity model than at the bottom. I think it's about the data. Many organizations have used electronic medical records for quite some time, but they haven't really taken a look at the results. And when you start showing physicians results for quality measures, have you done a foot exam on a patient, they're shocked. Their scores are incredibly low, and they know that they do foot exams, but they haven't documented those foot exams. So I think there's a learning curve that's happening now that says, oh, we're going to start using this data. We better do a better job making that data available, doing the right kind of documentation, because this will going to affect our bottom line, frankly, and that tends to drive increased compliance, if you will. I often get asked, why is what we're doing today any different than what was going on in the 90s when there was capitation and withholds? And I think there are really 2 issues. One is, back in the 90s, I was actually working in a health plan, and health plans developed their own little reimbursement methods, and they sort of handed them to the physician and said, sign here. So I don't think the doctors really knew what they were getting into, number one, and number 2, they never got any data to show how they were doing. So they'd work really hard for a year trying to meet these capitation goals, and at the end of the year get told, you overspent. You're not going to get any money back. So there was no collaboration, and there was really no data to help the physicians manage their practices better. I think it really goes back to fail fast, fail often. This is not an initiative that is for the weak of heart, but there is a way to go into the market gently. Don't be afraid to fail, because there will be failures. The opportunity to improve and to make a difference after you failed, to create those lessons learned, is tremendous. So it's really about a learning cycle, I think, that we're in. And organizations will never be able to move through the maturity curve, be able to be successful, if they don't continue to learn by their mistakes. I think it was an opportunity to show how an emerging technology market, population health management, as young as it is, really provides the opportunity for healthcare organizations, giving them the tools to really improve population health management.